for joining us on this beautiful day to recognize the start of Trauma and Mental Health Awareness Month. For over 3 years, HEAL PA has been working to implement the Trauma-Informed Pennsylvania Plan to assist all of our agencies and many of our counties in becoming more aware of how chronic stress and adversity can impact our mental health and overall community well-being. I have been very proud to be a part of that movement as your child advocate and as a leader of HEAL PA. So thank you all for coming and for being a part of this day. These days, we hear people talk about trauma more frequently, but we often forget to consider what it means in our own lives. Today, we bring awareness to the impact that individual healing can have on our collective community. We recognize the importance of healing from our own trauma and mental health struggles as being central to our public health and our public safety. So I encourage everyone here today to say to themselves, it starts here. It starts with me. And while the ripple effect of addressing mental health starts within each of us, I'm very honored to stand here today with members of the Shapiro administration who are paving a way forward for a healthier Pennsylvania, and members throughout our communities in Pennsylvania who are guiding healing in each of our counties. Please join me first in welcoming Deputy Secretary of our Office of Mental Health and Substance Abuse Services, Jen Smith.
Good morning, and thank you, Mary Ann, for that introduction. Thanks to all of you for being here today. My name is Jen Smith, and I serve as the Deputy Secretary for the Office of Mental Health and Substance Abuse Services within the Department of Human Services. Say that 6 times fast. I am really honored to be here today to recognize Mental Health Awareness Month along with so many of these well-accomplished and well-meaning advocates and professionals who work every single day to make sure that our fellow Pennsylvanians can get the behavioral health care that they need. The Shapiro administration and the Department of Human Services has made it a priority to ensure that all Pennsylvanians have equitable, affordable, and local access to behavioral health services. I'd like to talk with you today about what that looks like, including the reality of where we are, and about the hope of where we want to go to improve the health of all Pennsylvanians. Our mental health and physical health are equally important. If we do not address our behavioral health challenges and needs, we can't show up for our families, our friends, and perhaps most importantly, for ourselves. As a society, we have made a lot of progress in building a more open, empathetic community and inviting people to share our authentic selves. While the work to reduce behavioral health stigma continues, we have come a long way thanks to the advocacy and commitment of those folks here today. But there's still work to do, still a lot of work to do to get individuals the help that they need, especially ensuring that they get the right kind of help without delays. More than 1.8 million Pennsylvanians have a mental health condition. Every one of them and their loved ones deserve the dignity of receiving the right care at the right time in the right setting. Every county is facing challenges related to serving their community members with behavioral health needs. And we know that these needs do not occur in a vacuum. Often, behavioral health issues can be caused by or worsened by trauma. Trauma can occur at the individual level or the family level, such as circumstances of abuse, domestic violence, or substance use. There's also something called systematic trauma, like when a person experiences racism, poverty, a lack of education, or lack of access to health care. We must also continue to address the ever-present challenges in our Commonwealth, such as the effects of the opioid epidemic or other substance use disorders. The list of what we need to do is long, but we're making progress. Last year, The governor's budget invested $20 million in funding for county behavioral health services. Many of these systems had not seen investments since 2008. An additional $20 million is being proposed for this current fiscal year because we know that counties desperately need more funding and they need it now. We also want to continue building a sustainable crisis system. When someone's in crisis, they need access to three things: someone to call, someone to respond, and somewhere to go. Pennsylvania's adoption of the three-digit 988 National Crisis and Suicide Lifeline was a tremendous step forward in breaking barriers to support people experiencing a crisis, or those looking to help a loved one, a neighbor, or a fellow community member. More than 8,400 calls were made to 988 in Pennsylvania in March of 2024 alone. 1 month, 8,400 calls. We must continue to support this critical resource and the workforce that is available 24/7 to help Pennsylvanians in need. 80% of those calls that I mentioned to 988 are stabilized over the phone or through chat support, and they avoid the need for emergency in-person support services. But if a person does in fact need in-person support, we have to make sure that no matter where they live, they have somewhere to go where they can receive appropriate, trauma-informed, empathetic care. Unfortunately, emergency rooms and county jails are often the only option for individuals in crisis. Investing in comprehensive crisis response will help people get timely care while easing the strain on other systems that are less equipped to stabilize a behavioral health crisis. Crisis walk-in centers are an essential component of addressing a behavioral health emergency in a way that prioritizes safe and appropriate care for the individual circumstances. While some counties have invested in comprehensive crisis response systems, these supports are not available everywhere in Pennsylvania, yet. That's why the governor's proposed budget includes $5 million to help establish or maintain behavioral health crisis walk-in centers in counties where they are not currently available, and to provide additional funding throughout our systems of care to assist people who are uninsured or underinsured. These programs can literally save lives, and they can give people the hope, support, and confidence that they need to get better. Mental health is integral to our overall health, and we must ensure a robust behavioral health system to meet Pennsylvania's needs. The Department of Human Services is committed to building and sustaining a behavioral health system of care that is both resilient and responsive today and in the future. Thank you so much for joining us.
Our next speaker is Dr. Christina Finello. Dr. Finello is the Executive Director of Governor Shapiro's Behavioral Health Council.
My phone's there. Good morning. I'm Christina Finello. I am the Executive Director of the Pennsylvania Behavioral Health Council. The Shapiro administration has made the health and wellness of our citizens in Pennsylvania a priority, and that includes mental health. We know that co-occurring mental health issues and substance use disorders amplify risk, including higher morbidity and mortality, increased treatment costs, homelessness, incarcerations, and suicides. Suicide is a severe public health concern, especially among youth, where it's the second leading cause of death. A significant number of Pennsylvanians, including youth and adults with mental health conditions, have not fully received all the treatment that they need. We also know that, according to our Safe to Say Something program, a school safety program run under the Attorney General's office, they have received over 120,000 tips to identify individuals at risk. Unfortunately, Pennsylvania faces shortages of mental health providers, which exacerbates these problems. And the lack of mental health care has overwhelmed our emergency departments, which can lead to overcrowding and delays in care. The state recognizes the need to address these issues comprehensively and collaboratively to improve health outcomes for all Pennsylvanians. Late last year, the governor signed an executive order creating the Behavioral Health Council. The purpose of this executive order is to bring together representatives from not only state governments, but also local governments, social service provider agencies, mental health and substance use providers, and individuals with living and lived experience to set the agenda for behavioral health under the Shapiro administration. This council consists of a diverse array of stakeholders, including representation from state, county, local government, the provider community, advocacy groups, all seeking to create a whole-person healthcare delivery system in Pennsylvania. The council is charged with creating a roadmap to address gaps in access, affordability, and delivery of mental health and substance abuse treatment services. It will create a statewide action plan aimed at removing silos across state agencies, healthcare providers, payers, and state and local government sectors. This will ensure a more efficient use of resources across Pennsylvania. The ultimate outcome of this work is to create a more user-friendly and whole-person approach for individuals with mental health and substance use disorder care needs. Some of the things that the council will consider, and this is not an exhaustive list by any means, but some of the things the council will be looking at Pennsylvania's behavioral health care landscape and identifying where gaps and vulnerabilities in access to or delivery of services may exist. We're going to create a shared and comprehensive understanding of the resources that are allocated, services that are rendered, and stakeholders that are engaged in mental health and substance use service provision. This will utilize the work of existing work groups, such as the HEAL PA Coalition, the Mental Health Planning Council, the Interagency Substance Use Response Task Force, and other statewide groups that focus on developing solutions to streamline access, delivery, and cost. The Council will also identify unmet health-related social needs and inequities, and how those inequities impact mental health and substance use disorders and the delivery of health care. We also want to establish better coordination between public safety, courts, and behavioral health, and to emulate models that work in other places to better support people that have behavioral health needs who are involved in or at risk of becoming involved in the criminal justice system. We'll be reviewing the availability and the cultural competency of mental health services in historically underserved communities. And we'll be recommending policy, regulatory, programmatic, and investment proposals that will positively impact availability, timeliness, and quality of behavioral health care. We want people to be able to get the care they need when they need it. People need access to the right kind of treatment at the right time to meet their needs. The work of the Pennsylvania Behavioral Health Council will create a framework to improve access, affordability, and quality of behavioral health services. We hope that Pennsylvanians will have an easier time getting access to the necessary care, reducing emergency department visits and wait times across the board. The state will invest in a resilient behavioral health delivery system, improving the lives of those with mental health and/or substance use disorder needs. By addressing gaps and fostering collaboration, the Council will make significant strides in enhancing the mental health landscape in Pennsylvania. The Behavioral Health Council will promote better coordination between various agencies, leading to a holistic approach to improving health outcomes for Pennsylvanians. This initiative aims to reduce the burden of mental health and substance use disorders on communities across Pennsylvania, resulting in better overall well-being for its residents. Ultimately, our behavioral health system of care will help our families, friends, and neighbors here in Pennsylvania get help when they are in need. Thank you so much for your time today.
Thank you so much, Dr. Finello. Our next speaker is Dr. Dana Milakovic. Dana is the mental wellness and trauma specialist with the Pennsylvania Department of Education. She is also a dear, dear friend and a co-lead on our Executive Steering Council for HEAL PA. Please help me welcome Dr. Malakovic.
Good morning, everyone. As Dr. McAvoy said, my name is Dr. Dana Malakovic, and I am the Mental Wellness and Trauma Specialist for the Department of Education. And I have to pause and say that all of these youth voices here today and just seeing all the excitement around youth just really makes my heart happy. So I do have to say that. I am also honored to be one of the elected members of the Steering Council for HEAL PA, and I am the co-chair for the education team. Trauma's impact is far-reaching. It affects many Pennsylvanians of all ages and backgrounds. Adverse childhood experiences, community violence, and countless other stressors leave deep wounds impacting our health, our well-being, our learning, and future opportunities. But there is a path forward. By creating a trauma-informed Pennsylvania, we can foster a supportive environment where individuals and communities heal and reach their full potential. This journey cannot be done alone, and we've heard what the state is doing, and that is very important, but we also have to think about what does the collaborative, collective effort look like, and that is where community coalitions come in. These powerful groups unite diverse stakeholders, educators, healthcare providers, faith-based organizations, and residents, all united for one shared vision, building a trauma-informed community from the ground up. Community coalitions are the cornerstone of building a trauma-informed Pennsylvania. They provide local expertise. Coalitions understand the unique needs and challenges of their individual communities. They are the boots on the ground, tailoring solutions that meet the needs of the residents in their area. They have shared knowledge and best practices. They foster the collaboration and information sharing that happens at a state and local level, ensuring that best practices in trauma-informed care reach every single part of Pennsylvania. By establishing a coalition in every one of our counties, we can ensure that no community is left behind. They also help with sustainability. By working together, coalitions can leverage local and state resources and create a robust network for long-term sustainable change. I want you to just take a second and imagine a Pennsylvania where schools are equipped to identify and support students who are impacted by trauma, and they're dedicated to creating safe and supportive learning environments, where our healthcare systems are trauma-informed and are offering sensitive and effective care for everyone that they see, where social services are tailored to address the specific needs of trauma survivors, providing the support they need to heal and move forward, and where communities have the resources and knowledge they need to build resilience and prevent trauma in the first place. This is the Pennsylvania that we can build together. Our commitment goes beyond words. HEAL PA is dedicated to supporting coalitions across all of our counties. We aim to empower these vital coalitions through community conversations and support through our HEAL PA community coalition networks. Our goal is to provide the tools they need to make real, lasting differences in every single part of Pennsylvania. Building a trauma-informed Pennsylvania is more than a top-down approach. It's a collaborative effort, and the community coalitions are the heart and soul of that effort. By intentionally focusing on the development of coalitions and supporting their work, we can all work together to create a brighter, more resilient future for all Pennsylvanians. Thank you so much for being here today.
Thank you so much. I'm so happy that you brought up the work that's being done in our communities, because our next few speakers are all leading organizations that are focused on healing and that are providing support every single day throughout Pennsylvania. Our first speaker is Christine Jackson. Christine is the Executive Director for Hope for Hallie. Please help me welcome Christine.
Good morning, ladies and gentlemen. My name is Christine Jackson, and I'm honored to stand before you and share about an organization formed in memory of my daughter. 4 years, 6 months, and 3 days since my 16-year-old daughter died by suicide. That is 1,647 days that I have tried to live without one of my children. Too many days since I have seen my beautiful Haley, heard her infectious laugh, or hugged my sweet girl. The pain is unbearable, and our family is completely devastated without her here. She truly was the best of Kevin and myself, and so much more. The best little sister to Scotty, and an awesome big sister to Matthew. Together, we were the Jackson Five. Much of Haley's short life revolved around sports. Everything from cheerleading and field hockey to track and field. The girl had lightning speed and was a 2-time state champion as well as a Penn relay champion. Not surprising since she started walking at 8 months old. Haley possessed many wonderful qualities. She was kind, spirited, goal-oriented, and friendly. She just wanted everyone to get along and have fun. My world is darker without her here. And although I can wipe the tears from my eyes, I can't wipe the pain from my heart. In the days and months following the loss of Haley, many teens reached out to us and were willing to share their struggles. For some, it was the daily stress of school or sports. Others, depression or anxiety. Some shared complicated relationships with family and friends, or the fear of needing to be perfect and get stellar grades. It was then that we realized that the loss of our beloved Haley was opening up a conversation that needed to continue. So Kevin and I vowed to help others in Haley's name, to try and spare other families from this pain. Hope for Haley was established in August 2020 as a 501c3 organization with a mission of transforming conversations around mental health through connection, awareness, resources, and education to build hope for adolescents and young adults. Hope for Haley removes the barrier of cost to care, making therapy and support accessible to individuals seeking mental health services. Through our care program, Hope for Haley strives to create meaningful and authentic connections with the community, region, and nation to continue Haley's legacy of connecting with others. Whether that means putting together a support group after a crisis, joining a school presentation, attending a community event, or launching a color run, we're invested in creating a healthier world. Every conversation sparked, every connection made brings us one step closer to our goal, a society that sees mental health as an essential aspect of well-being. Hope for Haley hosts events to both increase awareness and raise funds to support our programming, including our annual Memorial Golf Outing, Rides for Awareness and Car Show, Candlelight Vigil, and a night at Citizens Bank Park with the Phillies. Hope for Haley offers access to professional mental health counseling for adolescents and young adults through our scholarship program. This approach provides access to those who may otherwise struggle in silence. Hope for Haley sponsors in-person and virtual events, including Dine with Your Mind, conversations about mental health with Dr. Green from Greensight Sports Psychology, and a conversation with T.U. Luter regarding mental health in high school, as well as grief around the holidays. As Haley's living spirit, hope for Haley's work is life-changing and life-giving. Her legacy is giving wings to hope. Let us continue to ignite hope, knowing that our collective efforts will illuminate the path towards a future where mental health is not just a conversation, but a priority for all. Thank you for listening.
I can't express the amount of gratitude that we all have for having you both here with us and for sharing the work that you're doing with Hope for Haley. As we talk about the different pains that we've all experienced, we want to remember that research shows us how the mind and the body are interconnected, that continuing to move, to breathe, and to engage in artistic expression can help us heal. I want to thank everyone who joined us for our Yoga on the Steps this morning. And our next speaker led that wonderful display of community healing. Please help me welcome owner of Y6 Yoga Collegeville and Exton, Lacey Schmidt.
Good morning, everyone. Thank you all for being here, and thank you for this amazing invitation to be here today. My name is Lacey Schmidt, and I am the owner of 2 yoga studios, one in Collegeville and the other in Exton. And today we led Yoga on the Steps, which was one of the many things that we do. My lead teacher, Chris Hefner, is here with me today, who led that beautiful practice. We are so passionate about stepping into our community and inviting our community members inside of our space to broaden the idea of coming deeper into the body and the mind connection. As we know, it is a lot more than just taking care of our body, right? And so physical movement, for sure, is what we strive for at our yoga studio. But the entire workout, it's not just that, right? It's not just a workout. The idea is to create an experience out of the exercise. So our students get to come into our facility and work together as a community to step into the idea of inquiry. We ask leading questions during our class so that our members can go a little bit further into their journey, into their self with a capital S. So our experience is an all levels, total body experience where we believe that our students come into the idea of inquiry so that they can deeper understand who they are and so that they can give to the world. So today's idea on our capital steps today was to tap into the 3 simple words, I am enough. And if all of us can say those words, and not just say those words, but believe those words, this world would be a much safer place, right? And so thank you to everybody that I'm standing with today for making our students, our adolescents, our adults understand the true meaning of that and be able to find that within themselves. So please join us. You can stop by. I know it's not exactly right down the street for you guys, but we're here to support you and to spread the love for yoga, whether you're practicing in your own house or at a studio space. We invite you to dig deeper into that self-inquiry and fall into the path of connecting breath to movement. Thank you all for being here. Thank you for having me today.
So as many of you know, we have a number of activities happening today. In addition to Yoga on the Steps, we were incredibly lucky to be able to bring the I'm Fine project to the Capitol this year. If you haven't yet toured the building, I want to invite everybody to head on down to the East Wing at the end of our press conference to see the amazing art exhibit that the I'm Fine project was able to display in the Capitol East Wing. Our next speaker is the co-director of I'm Fine. Please help me welcome Maureen Joyce.
First and foremost, thank you to the Governor's Office and to Pennsylvania Council on the Arts. and to you, and to you, and to all of you for understanding that there is a vital and important intersection between mental health and the arts.
I'm fine. Something we all say when we're maybe not so fine. Our project was born out of love, loss, art, and crisis. After we lost our son Patrick to death by suicide, I realized that art was what would help me survive. With that, and my friend and powerful co-director and community engaged artist, we began our work. Now, after 5 years, 74 residencies and workshops that have been conducted throughout Pennsylvania, we have over 1,500 ceramic masks that were made by workshop participants that speak about what they feel the mask they wear looks like to portray the struggles that they go through or the strength that they want to portray. I'm Fine is a statewide Pennsylvania project. It is dedicated to sculpting mental health and conversation with art. We all know this country is in a crisis. But as artists, Carrie and I believe in the power of art to ignite change and change the perspectives of our communities. We also believe in you, the community, as the agents of that change. Thank you.
Thank you so much, and it truly is an extremely powerful exhibit if you get a moment to go down to the East Wing and see all those amazing masks that were developed throughout Pennsylvania. Lastly, but certainly not least, HEAL PA is incredibly proud to say that this is the 3rd year in a row that we are creating these types of activities throughout our Capitol building to recognize Mental Health and Trauma Awareness Month. And we are doing it under the umbrella of a more national movement because, as Mojo mentioned, this is something that our entire country is struggling with. So we are very, very proud, very honored to be able to welcome Heather Proctor, President and CEO of We Heal Us, to the podium today. Welcome, Heather.
Good morning. It's so amazing to be here. 3 years ago, I never would have imagined that we would be here because, we didn't have such a thing happening, and here we are. First and foremost, I want to say thank you to Governor Shapiro, his administration, and the state of Pennsylvania. What we've been able to do over the last 3 years is collaborate and really bring together organizations, non-for-profits, state government, local government, and really be able to have a lens through mental health and trauma awareness. It has been absolutely phenomenal, the outcomes that we've seen thus far. When we approached the state of Pennsylvania and asked them if they wanted to participate, they were very eager, and from there, they're like, we want to invite other organizations in other states, so here we are. Our goal and purpose is to unite under a space of healing. And how do we do that? This is the journey that we all continue to take together. It's a journey of realizing that we have our own personal trauma, that we have our own things that we've experienced that we may or may not have shared with other people. Our own family members, our own relatives, our own neighbors who are struggling with mental health. More than anything, through the last couple years, I think we all can say we've had moments in time where we felt very alone, where we felt very isolated, where we didn't know necessarily, how to reach out. Creating spaces where we have the opportunity to have a bigger collective voice, to say we understand that as an organization, as individuals, that we can heal. And we continue to do that by bringing awareness to mental health, to understanding trauma, to understanding how it has affected us. And when we have that lens, then we can heal. Then we can share with others, one person at a time, one organization at a time, neighborhood by neighborhood approach, bringing together government, private, public organizations where we can say we can make a difference. We all are in this together, and we choose to heal us. We choose to grow. We choose to heal. We don't necessarily have to have all the answers, right? That's why we have these amazing organizations that can support us, that provide tools, that provide resources, that continue to help us as we go on our healing journey. And I encourage everyone to look into Heal PA, the organizations and the coalitions that are being built around the state, how you can get involved, where you can go for resources, and also the presenters here today as well. I'm so incredibly grateful and thankful for the capacity to be able to continue to amplify the voices of states and organizations like the ones that are represented here today. It is so important, and I thank you very, very much. Thanks.
Well, I echo those sentiments. Thank you all very, very much for joining us today. Your presence here really signifies the commitment that we have to recognizing the intersecting nature between trauma, chronic stress, and our mental health. We encourage everyone to stay connected with Heal PA, with all of the organizations that joined us today, and to learn more about ways that we can support healing within our communities and within ourselves. Please remember, if you or anyone you know is in need of immediate mental health support, that you don't need to hesitate and you can contact 988. Keep moving, keep breathing, and remember, it is more than fine not to always say, I'm fine. Thank you, everybody.